This is Jim. He is a nurse. Jim knows that good hand hygiene practices are important to keep our patients, clients, and others safe. Throughout the day, Jim is picking up and transferring germs. However, Jim is busy and sometimes forgets to clean as often as he should. It's the end of Jim's shift. He's had a busy day and is ready to go home to see his family. Unfortunately, Jim forgot to clean his hands before he went home, and now Jim is sharing more than a hug with his family.
Hello, my name is Kateri Singer, and I'm the manager of the Regional Infection Prevention and Control Department for the Regina Qu'Appelle Health Region. I would like to thank you today for taking the time out to watch this most important video. Although this video has a lighthearted aspect to it, it carries a very, very important message. On average, less than 40% of healthcare workers wash their hands at the appropriate times. Because of this, in Canada every year, we see 200,000 healthcare-acquired infections. It's important to remember that of those 200,000, 8,000 people die annually. There are key times when we need to wash our hands. When we enter the facility at the start of our shift, before we have client contact, including before donning gloves so you don't cross-contaminate them, when you perform an aseptic or a clean technique, when there's a risk to exposure, when you leave the client or the client's environment, and lastly, when you go home, take off your uniform, change, and wash your hands on the way out. It is up to us to protect our patients, clients, residents, visitors, and family from those germs. Don't forget, at the end of the day, we can take those germs home with us. Clean hands save lives.
This is Martha. She is a patient. Martha understands that good hand hygiene is important for keeping her safe from infections. Martha didn't see Jim wash his hands when he came in her room and kindly asked if he would do so. Jim hadn't even realized he missed washing his hands, but is thankful Martha felt comfortable asking him.
Every day, patients catch germs from the hands of healthcare workers. These germs can cause serious infections, and in some cases, even death. Every year, over 200,000 patients get an infection while receiving healthcare in Canada. As a result, over 8,000 patients will die. If you don't see your healthcare provider washing their hands before touching you, please ask them to do so. Safe healthcare is your right, and clean hands save lives. Remember, it's safe to speak up.
This is Tom and Liz, Martha's family. Tom and Liz recognize that good hygiene is important for keeping germs at bay, so they cleaned their hands when they came into the facility. However, they don't understand that they can also potentially infect their mom from the things they touch on the way to visit her. When Martha asks Tom and Liz to wash their hands, they are happy to do so. They want their mom to be safe from infection. Martha is thankful that Tom and Liz understand how important it is to clean their hands again.
Did you know that in any moment of time, your hands can be carrying a ton of germs on them? These germs can lead to serious infection or even death to those that we love and care about. Every year, more than 200,000 Canadians catch a hospital-acquired infection from their care providers or visitors. More than 8,000 of these patients will die as a result. When you visit a hospital or another healthcare facility, please ensure that you wash your hands when you enter the building, before you touch your friend or your loved one, and again when you leave. Clean hands truly do save lives.